Tonight, we're getting a good look into the minds of police officers. They're on the front lines of danger and facing ever-increasing scrutiny from commanders and community alike. They're also killing themselves at an alarming rate. For months, the News 4i team worked with the Fraternal Order of Police to survey thousands of the nation's cops, and the results are eye-opening. Here's News 4's David Ushery.
Put your hands up!
Who's in there? Who's in there? This is what cops across the country see.
A baby in the car, too.
Every day, hundreds of thousands of stressful situations.
Shots fired, shots fired.
Some big.
We got multiple people down.
Some small. But all taking a toll. In 2017, 140 police officers took their own lives, a higher rate per capita than the civilian population. In Chicago alone, a city grappling with a skyrocketing homicide count, the officer suicide rate is 60% higher than other departments.
We have to get to a place where, we realize that cops are people too. They have the most dangerous job on earth.
Dr. Bobby Boges poured grief and anguish into a book called Cop Suicide, Diary of a Devastated Widow. She found her late husband, Lieutenant Ronald Lattimore of the Plainfield, New Jersey Police, dead in their garage. He shot himself. To this day, she says, she doesn't know why.
They can't talk to their families because they think they're going to burden their loved ones. They think it's weak to go to a therapist, and they have nowhere to turn.
Indeed, it is difficult to get a police officer to admit mental health concerns, much less go on the record to talk about them. But we found a way to hear from them. In cooperation with the Fraternal Order of Police, News 4 sent anonymous surveys to cops all over the country. Nearly 8,000 responded.
8,000 responses, I think, speaks to the importance of this topic in the law enforcement community.
78% of those who answered say they've experienced critical stress on the job. 68% say that stress leaves them with unresolved emotional issues. 16% had thoughts of suicide. 90% of those surveyed think there is a stigma in law enforcement that creates a barrier to getting help for emotional or behavioral issues.
There are some departments across the country, unfortunately, that still don't really offer a lot of mental health services or wellness services to their police officers. That's where the survey is going to bring light to those shortcomings and help us to develop better programs.
This is not to say that streets are flooded with cops who are emotionally impaired and unfit for duty. Nor do the numbers excuse some of the controversial actions of officers that have caused tension in many communities. But the survey helps paint a fuller picture of the burden of the badge, the day-in, day-out grind of domestic disputes, horrible accidents, and killings that don't always make headlines.
Before you can take care of anyone else, you must first take care of yourself.
NYPD Commissioner James O'Neill took to social media last spring after an officer's suicide. He told me the issue is a top priority for him. In his 36 years with the department, he has lost at least a dozen friends on the job to suicide.
This has got to be everybody in NYPD paying attention to it. And that's hard, too, because it's, no cop wants to, say something that might affect another cop's career negatively. But we got to get past that. We got to get beyond that. We've had 4 suicides this year and 3 attempts. And that's unacceptable.
One of them was Emergency Services Officer Nick Budney.
The best of the best. That was Nick.
His brother Chris says Nick dreamed of being a cop since they were kids. He went on to work in a gritty Bronx precinct where he was Officer of the Year 4 times before joining the elite ESU. Chris says Nick was doing what he loved and seemed happy. In January, he shot himself. He was 36.
The last time that I saw him in person face to face, he was as happy as could be. I remember the color shirt that he was wearing and the smile that was on his face.
We don't know why Nick Budney took his own life, but overall, whether it's shame, fear, or bravado, our survey suggests many who wear the shield are shielding their emotions, and they are not alone. The only reason loved ones would revisit their pain for this story is to help others avoid it.
I just really wish that officers would realize that they're human and there's help available. There are resources available, and there's no shame in asking for help.
There is no shame in asking for help. Many larger departments, including the NYPD, have employee assistance programs and other resources for officers. The Fraternal Order of Police is hoping the survey can boost their efforts to get smaller departments such programs, and mostly to get officers talking about it. David Ushery, News 4 New York.